Hi, very good morning. My name is Sheikh Shavadi. I am from American Oncology Institute, Kanuru, Vijayawada. Today we are with Dr. Kranthi Kumar sir, radiation oncologist, Vijayawada, Kanuru. So our general topic it is today, awareness of general cancer in public it is. So we welcome Dr. Kranthi Kumar sir for the live show.
Thank you, Mr. Sheikh. Hi, I am Dr. Kranthi Kumar. I am a consultant radiation oncologist at American Oncology Institute, Vijayawada. So today we will discuss briefly regarding the general awareness regarding the cancer.
Doctor, what is cancer?
So cancer means it is unwanted, abnormal and unregulated growth that is present in the body or started in the body. So abnormal in the sense which is normal and unwanted means which is not required to our body, and unregulated means which is not regulated by the body. So this is what basically in medical terminology what cancer means.
Does any organ in the body can spread the cancer from getting cancer?
So this is the common question most of the patient attenders usually used to ask in the OPDs. Does any organ in our body can be spread? So the answer is any of the organ in the body can be at risk of getting cancer. So there is no organ that it is escaped from the cancer.
Is it cancer contagious?
No. So people are having the same questions like, sir, doctor, can we eat in the patient's plates, and can we sleep with the patient? Or can another majority of the times people used to ask, there are small kids in the family or in the house, so can we make the patient to be with the children in the family? So cancer is not a contagious disease, so you can freely move and you can be with the patient, and you can be with the patient in the house.
Does all cancers are painful?
No. So some of the people, usually, especially in case of oral cavity and breast cancers, people usually come with the complaints of we have the lump in the breast or in the oral cavity, but it is not painful, and pain started just a few weeks back. So this is a wrong assumption or misconception in the community that cancer causes pain. And cancer can cause pain, but it doesn't mean that only pain when it arises from a mass or an ulcer, then only it is a cancer. So it is not vice versa. So majority of the lumps or the ulcers that is present in the breast or in oral cavity, they can be painless, but it can be cancer also.
Does all cancers are the same?
No. So the answer is no, because the same disease, like suppose if you take one particular case of CA breast, so cancer of the carcinoma of the breast, it is not the same even in the same individual if it is in the stage 1 or stage 2 or stage 3 or if it is stage 4. So not all cancers are same, and not all the cancers having the same treatment also.
Doctor, there are many assumption that many people are whether the cancer is curable or it is from hereditary. So any suggestions for that?
Yeah. So majority of the cancers, if they are diagnosed in the early stages, like especially if it is in the stage 1 or stage 2, majority of the cancers are curable at present day newer techniques and newer treatment methods. And people usually ask, especially the attenders usually ask that if they are accompanying any cancer patient, they usually have the doubt like whether this cancer be hereditary, that if suppose mother is having the cancer, the daughter or son also can be able to get the cancer. So not all the cancers are hereditary. So it's hardly around 5 to 10% of the cancer cases are hereditary, and the majority of the cancers are sporadic. So some of the cases like colon cancers and breast cancers, in this some of the cancers are hereditary, but majority of the cancers still they are sporadic.
Doctor, what are the common risk factors in cancer?
So few of the risk factors we can not able to modify, and a few of the risk factors we can able to modify. So the risk factors we cannot modify it is the carcinomas that are related to the age or sex or race. So we cannot able to modify. So the risk factors like tobacco chewing, alcohol consumption, and frequent oral cavity infections, and wild discharge or bleeding per vagina, screening and all, and sedentary lifestyle and increased body fat. So these are the risk factors we can able to modify. So if we can able to change these risk factors or modify these risk factors, so we can able to minimize the occurrence of cancers in the patients. So few of the risk factors we can able to modify. So they are majorly like majority of the people knows like tobacco chewing, alcohol consumption, sedentary lifestyle, obesity, frequent infections, and pollution, and unhealthy diet, food habits.
Doctor, how to prevent cancer?
Okay, so as we discussed, the risk factors that I can able to modify, so especially like tobacco chewing and alcohol consumption, by avoiding these, we can able to minimize occurrence of malignancies. At the same time, increasing fiber content in the food, and regular exercises, and avoiding the repeated use of oils, and drinking plenty of water, and avoiding junk foods, and avoiding repeated usage of oils. So with this, and also avoiding multiple partners, and frequent screening, and participating in frequent screening programs after certain age. So by these methods we can able to prevent some of the cancers, and we can able to detect it.
Doctor, are cancer symptoms all are unique, and when we can suspect it?
So this is also one of the common question majority of the patient and attendants usually ask. So cancer symptoms are not unique, and that means like specifically if the patient is having this complaint and this related to this cancer, it's not like that. So cancer also will present with regular symptoms only. So the symptoms usually what we usually get, and when we have to suspect cancer, it is like, suppose if you take oral cavity cancers, patient will be having ulcers over the upper mucosa or tongue or in the hard palate area. So these ulcers, they will be after usage of medication, they will be progressing continuously, or they will be dissolving and again reappearing after some time, or frequently reappearing ulcers. So at the same time, suppose some patients will be having difficulty in swallowing, so this will not be relieved with the medication, or even after relieving the medication, again the reappearance of the symptoms. So these are the this is the way how the cancer patient will be presenting, like the repeated and prolonged complaints. At the same time, suppose if you take lumps in the breast, the lump will be initially small in size and it will be keep on progressing, and after some time it might be starting pain or some ulceration of the skin. So these are the way. This is how the complaints may be increasing. So when can we suspect that it might be a cancer? I will explain in 3 examples. So if you take in oral cavity cancers, like suppose if it is a ulcer over the tongue, so the repeated recurrence of the ulcers over the tongue, or progression of the ulcer even after medication. So in this case, we have to suspect whether it can be a possibility of malignancy. And suppose if you take breast, in breast, then almost 90-95% of the times the lumps whatever we see in the breast are not malignant. They are like simple fibroadenomas or milkadenomas will be there. So if the lump it is keep on progressing in the size and also causing pain, and also if especially associated with any small swellings in the armpit. So in these cases we have to suspect it can be possible. It can be a possibility of malignancy. And if we take cervix cases or endometrium or uterine cancers, so people will be presenting even the regular patients like general infections also. They will be presenting like white discharge or bleeding per vagina. Even in cancer also the presentation will be the same. But in case of if it is infection related, it will be resolved within a period of weeks time. But if it is a malignancy related, the infection will be resolved and again the recurrence of the symptoms will happen. So if there is a recurrence of the symptoms, then we have to strongly suspect whether any background of malignancy is there in the particular organ.
Doctor, does early detection of cancer makes any difference?
Yeah. So majority of the cancers, if they are detected in the early stages, early stage means it is like stage 1 or stage 2. So if they are detected in the early stages, majority of the cases can be cured at present modern era of treatment methods and treatment techniques.
Doctor, how does screening help in oncology?
Yeah. So screening it will be helpful, especially if the disease started and it is not showing any symptoms to the person. So especially if suppose in cases of oral cavity or breast or in cervical malignancies, in some of the lung cases also, with the screening methods we can able to detect the disease even before it is turning into malignancy also. So I will tell you in 3 to 4 examples. Like suppose if you take oral cavity cancers, suppose after thorough clinical examination by the consultant doctor, so we can able to detect any ulcers in the oral cavity like tongue or hard palate or buccal mucosa or GB sulcus or floor of the mouth. So we can able to see in any ulcer over the oral cavity, and we can able to take sample from the suspected ulcer, and we can able to detect whether it is a malignancy or not. In the same way, suppose if the patient is having breast suspicious of breast malignancy, or in the screening also, suppose breast self-examination. So majority of the times this is a simple technique. Patient can do themselves the breast self-examination. It's like just touching the opposite breast. That means that right hand to the left breast and left hand to the right breast. So just palpating the breast and also the armpit, we can able to detect any lumps in the breast. And another simple test like ultrasound or mammogram. So we can able to detect the diseases like carcinoma breast in the very early stages. So for cervical malignancies, there is simple test like just local examination, simple local examination, and also one more test called pap smear. So with pap smear, we can able to detect any pre-malignant suspected cells present in the cervical area, or there is a possibility of turning malignant cells also in the cervical area. You can detect with the simple pap test.
Doctor, how cancers are diagnosed and staged?
Yeah. So once we suspect that this is a carcinomatous growth or malignant growth, there are simple tests like FNAC. We can able to, suppose if it is in the head and neck area, or in the armpit area, we can do simple FNAC, that is 5-needle aspiration cytology. So with this, we can able to at least confirm whether it is a malignant or not also. And once it is suspected in the FNAC, then the further confirmation test, it is the biopsy. So with the biopsy, majority are almost 90-95% of the cases we can able to confirm whether it is malignant or not, or what type of malignancy it is also. And suppose if in the biopsy, if the patient diagnosis it is not confirmed, we can say that it is a malignant, but what subtype. So that if it is not confirmed in biopsy, there is another technique like immunohistochemistry, that is what called IHC. So with the IHC, almost majority of the cancers which is not proven in biopsy, we can able to confirm in the IHC technique. So once the malignancy or cancer it is confirmed, there are certain scanning tools to say what stage the cancer it is. So for this, there are a lot of techniques like X-ray, mammogram, and CT scan, and MRI scan, and presently the most advanced is the PET-CT scan. So with these modern tools of scanners, we can able to detect what stage of the disease particularly it is at the time of diagnosis itself.
What are the modalities of cancer treatment availability?
Yeah. So there are broadly 3 modalities that are available for all cancer patients. So first one is surgery, second one it is radiation, and third one it is the chemotherapy.
Thank you, doctor. Thanks for providing me lot of doubts and clarifications. Thank you very much.
Thank you, Mr. Sheikh.
Thanks for watching the live session. Hope you have enjoyed the session. If you have any questions, please comment in the chat box live. For more informative videos about the cancer, do subscribe our channel, American Oncology Institute. Thank you.